Hello and welcome back to the channel. Today, we're diving into a story that's causing quite a stir in Scotland, and it has massive implications for the future of public healthcare. Imagine the person who used to be in charge of the entire health system turning around and saying, "We all got it wrong." That's exactly what's just happened. Jeane Freeman, who was Scotland's health secretary from 2018 to 2021, has come out with a bombshell statement. She's claimed that the current crisis in the NHS is the fault of successive governments, and yes, she explicitly included the one she was part of. This isn't just another political soundbite. This is an insider's critique of a system she knows inside and out. So, what's her main point? Freeman argues that politicians are fundamentally short-sighted. They're always focused on the next election, on what they need to do to either gain or keep power. In her own words, the problem with that is the substance of issues can get lost because what we're actually talking about is, what do I need to do to remain in power as opposed to what do I need to do to fix this? That's a pretty damning indictment of how political priorities can overshadow genuine problem solving. This short-term thinking, she says, has led to a major failure. Governments have listened to the people who actually run the NHS day-to-day. She believes the real experts are the clinical and frontline teams, but politics gets in the way of it. She's not just talking about doctors and nurses, but everyone from the housekeeping and janitorial staff to the booking clerks and maintenance teams. These are the people on the ground who see the cracks in the system every single day. Let's look at the context here, because the situation is serious. First Minister John Swinney has recently admitted that some people have had to wait far too long for treatment. The statistics back this up. As of last June, roughly 1 in every 9 people in Scotland is on an NHS waiting list. Think about that. Over 628,000 individuals waiting for care. And it's not just waiting lists. A recent survey found that a staggering 69% of Scots feel that NHS performance is actually getting worse. The Royal College of Emergency Medicine has even linked over 800 deaths in Scotland last year to long waits in A&E. These aren't just numbers. They represent real people, real families, and real tragedies. The pressure is immense, and it's been building for years, only made worse by the pandemic. So when a former health secretary validates these concerns, it carries a lot of weight. So, what's Freeman's proposed solution? It's refreshingly simple, but incredibly challenging to implement. She says, don't leave it to the politicians. Instead, she advocates for empowering the frontline staff. Get them all in a room, the consultants, the nurses, the physios, the admin staff, everyone, and ask them what needs to be done. She's confident they already have many of the answers. It's a call for a bottom-up approach to reform, rather than top-down directives from politicians. In response, the current Scottish government highlights its record investment of nearly £22 billion in health and social care this year. They're targeting the longest waiting lists and trying to get patients the care they need faster. They also point to long-term plans that were supposedly shaped with input from clinical leaders. There's also been a recent announcement of an extra £531 million over 3 years to recruit more staff for GP surgeries. This comes after the British Medical Association entered a formal dispute, arguing that funding for GPs hasn't kept up with inflation for over a decade. While this new funding is a step, it's subject to future budget agreements, which adds a layer of uncertainty. So, we have this fascinating clash of perspectives. On one hand, the government says it's investing record amounts and working with professionals. On the other hand, the former person in charge says the entire political approach is flawed, and that the real experts on the front line are being ignored. This brings us to the core of the debate. Is the problem a lack of money, or is it a broken system of governance? Jeane Freeman's comments suggest it's the latter. She is arguing for a fundamental cultural shift in how the NHS is managed, one that moves beyond the 4 or 5-year electoral cycle and puts long-term sustainable solutions first. She is effectively saying that until politicians are willing to give up some control and truly listen to the people doing the work, throwing more money at the problem might not be enough. This is a conversation that goes beyond Scotland. Many countries with public health systems are facing similar challenges: aging populations, staff burnout, and the long shadow of the pandemic. Freeman's critique of political short-sightedness is a universal one. The idea that those on the front line might hold the key to fixing the system is powerful, but it requires a level of political humility that is often in short supply. What do you think? Is Jeane Freeman right? Is the obsession with winning elections preventing real, long-term solutions for our health services? Or is the government doing the best it can with record investment in an incredibly difficult situation? Let me know your thoughts down in the comments below. This is a crucial discussion, and your perspective is valuable. Thanks so much for watching. If you found this breakdown insightful, please give the video a like and consider subscribing to the channel for more deep dives into the stories that matter. Your support helps us continue to make this content. Stay safe, and I'll see you in the next one.